Welcome. Today we'll be looking into the topic of the rise in the opioid crisis. This video will touch upon four main topics, which include what are opioids, the history of opioid use, ways to prevent an overdose, as well as ways to overcome the opioid crisis. Opioids are substances that act on opioid receptors within the body. Opioids are commonly prescribed by physicians to treat persistent and severe pain. However, there has currently been a rise in disorder and addiction surrounding the use of opioids. Currently, there have been three main waves surrounding opioid use as well as opioid-related deaths. Wave 1 was seen to begin when opioids were first being prescribed in the 1990s. With the death rate seen to increase after 1999. Wave 2 was significant with many of the deaths surrounding the use of the opioid heroin. The final wave, Wave 3, started in 2013 and was mainly caused from the use of synthetic opioids such as fentanyl. Here you can see a graph depicting the three waves of opioid-related deaths. When it comes to the reasons for the rise in the opioid crisis, there are three main reasons. The first reason is the failure of regulations surrounding the prescribing of opioids. Pharmaceutical companies deceptively promote opioid use in ways that are often neither safe nor effective, contributing to unprecedented increases in prescribing. Opioids are commonly prescribed to chronic pain patients and patients after surgery, without thinking about the detrimental, addictive, long-term effects that prescribing these medications can have on the individual. Another reason for the rise seen in the opioid crisis is due to the contaminated illegal drug supply. The illegal drug supply is being increasingly contaminated with fentanyl, a powerful synthetic opioid that increases the risk of accidental overdose. Contamination is the number one cause of opioid-related deaths in Canada. Lastly, the rise in the opioid crisis is also seen to have occurred due to an increased opioid dependence and tolerance. Opioid tolerance occurs when a person using opioids begins to experience a reduced response to the medication, requiring more opioids to experience the same response. The body adjusts itself and its normal functioning around regular opioid use. Unpleasant physical symptoms will occur when opioid medication is stopped. These are known as withdrawal symptoms. With the increase in opioid-related deaths, one might think about how we can prevent an opioid overdose. It is important to understand both the signs and the symptoms of an opioid use disorder. An individual experiencing an opioid use disorder might not show signs of disorder immediately. Symptoms that may develop over time include, but are not limited to, drowsiness, changes in sleep habits, weight loss, frequent flu-like symptoms, decreased libido, lack of hygiene, change in exercise habits, isolation from family members or friends, drug-seeking behaviors, new financial difficulties, as well as legal or social conflicts due to opioid use. If an individual with an opioid use disorder tries to withdraw from the use of opioids, they may experience some of the following symptoms: abdominal cramps, agitation, anxiety, elevated blood pressure, sweating, elevated heart rate, and insomnia, which is the inability to sleep. At times, individuals using opioids may experience an opioid overdose. It is important to recognize the signs and symptoms of an overdose, as this is a life-threatening matter which requires immediate emergency medical attention. Signs and symptoms of an overdose include an extremely pale face, limp body, vomiting, loss of consciousness, inability to speak, shallow breaths, and cardiac arrest. If an opioid overdose is recognized in time, an individual can be saved if they are given a medication known as naloxone, which has the ability to reverse an opioid overdose. Naloxone is an opioid antagonist that attaches to opioid receptors and reverses and blocks the effects of opioids. This medication can rapidly restore the regular breathing of a person and can be administered to anyone who shows signs of an opioid overdose or when an overdose is suspected. However, it is essential to note that naloxone only works in the body for 30 to 90 minutes. A person can still experience the effects of an overdose even after naloxone wears off, or may need multiple doses if a potent opioid is in their system. We will now move into our final topic of ways to overcome the opioid crisis. One way to overcome this crisis would be to initiate prescription drug monitoring programs. Currently, there is a controlled prescription program. This program is funded by the College of Physicians and Surgeons. Their main goal involved monitoring and providing education to providers about the substance rather than disciplining individuals. In addition, many Canadian provinces currently have prescription drug monitoring programs in effect. Another way to overcome the opioid crisis is to educate individuals on the topic of opioids. This can be done by giving out free naloxone kits, educating individuals on how to use them, as well as opening facilities to provide opioid overdose and naloxone training. That is all for today, and thank you for listening.